Dr. Riddhi, you can switch on your video and you can just use these slides for an introduction.
Madam, we are live now. You can start the session.
Thank you.
Dr. Riddhi, we are ready to start.
Yes, ma'am. Good evening, everybody. Today we are starting with the 25th session from the Medical Legal Committee of YOSI. The topic for today is laws and regulations related to biomedical waste management for eye care hospitals. I would like to introduce our panelists for today. It is Dr.
No, wait. The top.
Our panelist for today is Dr. Anand
Dr.
Deshpande.
Deepthi,
Yes, sir.
you are, I think in between you are not audible.
Okay. Should I
Please
restart?
continue. Please continue.
Continue.
Our panelist for today is Dr. Anand Deshpande. He is the director and eye surgeon at Guru Prasad Netra Rugnalaya at Aurangabad, chairman of the Indian Medical Legal Consulting Services Private Limited, chairman of the Medical Legal Committee of AIOS. He is faculty of law and visiting professor to the Symbiosis Law College in Pune, National Law University Aurangabad, faculty of management and management sciences at BAMU Aurangabad. He has written various books like Legal Aspects and Ophthalmology, to name a few. Next, sir. Our next panelist for today is Dr. Prakash Marathe. He has been the past president for Maharashtra Ophthalmological Society, Pune Ophthalmological Society, Indian Medical Association, Pune. He is a trustee of the Pune Ophthalmic Association and the IMA Pune, member of the Medical Legal Committee of AIOS, chairman of the Maharashtra chapter of the ISM SICS, past managing committee member of AIOS, past senior vice president of IMA Maharashtra. He has received various awards like the President's Appreciation Award by the National IMA Headquarters, the President's Appreciation Award by the IMA Maharashtra State, the President's Special Felicitation Award by IMA Maharashtra State, and the Pune Ophthalmic Society Late Asha Kelkar Award in 2022 by the Pune Ophthalmological Society. Our next panelist for today is Dr. Manoj Chandra Mathur. He is a senior consultant in glaucoma and comprehensive ophthalmology at Swaroop Eye Center, Hyderabad. Presently the honorary treasurer of AIOS, the past advisor and president of Telangana Ophthalmological Society and Hyderabad Ophthalmologists Association, co-chair of the Health Association and TPA Committee of AIOS. He has been a member of medical, legal and ethics committees of AIOS in the past. He has been twice member of the managing committee of AIOS. He has also served as a member of the advisory board of the IJO. I would like to introduce our speaker for today. She is Dr. Deepthi Molleti. She has completed her MBBS from Shri Devraj URS Medical College in Karnataka, her DOMS from JJM Medical College Davangere in Karnataka, her DNB from Shankara Eye Hospital, Bangalore, followed by completing her fellowship in cataract and community ophthalmology from Shankara Netralaya, Chennai. Further went on to do a glaucoma fellowship from Shankara Netralaya, Chennai. She is currently working as an assistant ophthalmologist in the Department of Glaucoma at LVP Vijayawada since January 2022, and she has a special interest in the management of congenital glaucoma. I would like to welcome Dr. Deepthi ma'am to our committee today. Thank you, ma'am, for gracing the event with your presence.
Thank you all for this opportunity. Can we have the presentation? So at the onset, I would like to thank you for the opportunity to be able to present on this particular topic. So my discussion today will be on medical legal aspects related to biomedical waste management. So in coming to infection control, it is the discipline concerned with preventing nosocomial or healthcare associated infection. It is an essential, though often under-recognized and under-supported part of the infrastructure of healthcare. So one of the most important integral part of infection control measures is biomedical waste management. Next, please. So what is biomedical waste? It is the waste generated from diagnosing, treating, or immunizing humans, or from research or production of biologicals. This includes items like needles, syringes, and blood-soaked bandages. Next, please. So the types of biomedical waste include general waste and biomedical waste. So the general waste are non-hazardous waste materials, common source being paper, rubber, plastics, and they can be disposed of using regular municipal waste systems. Whereas biomedical waste include chemicals, pharmaceuticals, radioactive materials. They require special handling and disposal procedures, potential to cause serious harm to health and environment. A part of this itself is the infectious waste. This is the waste contaminated with blood and bodily fluids, includes discarded diagnostic samples, culture swabs, and they need sterilization before disposal to prevent disease spread. So biomedical waste, where all do we generate in the eye hospital? One is surgical waste, use surgical blades, needles, tissue, excise tissue, used gloves, gowns, and drapes contaminated with blood or bodily fluids. Pharmaceutical waste, laboratory waste, and general non-hazardous waste such as paper, plastic, packaging material. Next, please. So coming to segregation of waste, according to the biomedical waste management rules of in 2016, they are segregated under the following categories, which I will talk about in detail in the upcoming slides. So according to the BMWM rules of 2016, waste must be segregated at the point of generation of source, that is where waste initially generates, accumulates, and it is under the control of doctor or the staff present there. So posters, placards for biomedical waste segregation should be provided in all the wards as well as in storage, waste storage area. Adequate number of color-coded bins, containers, and bags should be available at the point of generation of biomedical waste. Color-coded plastic bags should be in line with the Plastic Waste Management Rules 2016. And we also have to provide PPE to the biomedical waste handling staff. So this is one picture where we have all 4 bins along with the general waste, which is the green bin. Next slide, please. So in the yellow bin, there is disposal of soil, cotton swabs, tissue papers, filter paper, removed dressings, eye patches, used masks, and linen contaminated with any body fluid. Next, please. And in the red bin, IV drip sets, IV plastic bottles, used urine containers or empty reagent plastic bottles, used plastic syringes, tubings, and gloves. Next, please. In the blue, it is mainly discarded glass bottles. So any glass materials. Along with that, it could be some spirit glass bottles, slides, or used or broken capillary tubes. Next, please. So coming to the white bin, these are puncture-proof containers, which are used for disposal of sharps, that is needles, lancets, scalp vein, used insulin or tuberculin syringes with needle. So immediate disposal after, can you please go to the previous slide? Previous, please. So coming to the sharp disposals, so immediate disposal after use has to be done to prevent injuries. That is, whenever we use either a needle uh, for any suture removal at OPD, it is the responsibility of the doctor to discard the needle on their own in the white bin. So white bin preferably should be there. Not only white bin, all the color-coded bins preferably should be there inside the OPD as well as in the general corridor as well. so that the needle has to be immediately discarded. Next slide, please. So just a gist about the needle stick injury. That is the correct method for recapping in case required, but maximum it is advisable to avoid recapping. But in case you need to recap, we have to use the single hand technique as shown in the first picture. And when the doctor or the nurse is handing over the MVR blade, this is the technique that it has to be handed over so that neither of the person is at risk. And this is the way the needles are promptly disposed in sharp-proof containers. And apart from that, any needle stick injury, it has to be immediately reported to the HIC convener concerned HOD so that they will report this, and then the nature of the injury, and there will be a reiteration based on how the injury occurred, how it could be prevented, and blood sample of both the person who is accidentally got a sharp injury as well as the patient are taken, and samples are sent both for hepatitis C and B and HIV, and based on the results, if required, post-exposure prophylaxis has to be started immediately within 24 hours. So coming to the green bin, this includes waste papers, all packaging material, syringe covers, empty glucose test strip containers, needle caps, papers, food leftovers, etc. Next, please. So just an important quick note on the spill kit management. Whenever there's a blood or body fluid spill, use the blood kit, spill kit that is available. So the area where the spill has happened, it has to be delineated, and sodium hypochlorite solution has to be poured onto the spill, and wait for 10 minutes for disinfection. And meanwhile, PPE has to be worn, which includes mask, goggles, apron, shoe cover, gloves, and using cotton gauze pieces that are present in the spill kit. The body fluid has to be cleaned off, and dispose the cotton gauze in a yellow cover that is given to you. And as soon as it is disposed in that, the yellow cover has to be tied and sealed and mentioned as blood spill or body spill. And thereafter, the floor has to be marked with the cleaning agent as well. Next, please. So coming to the mercury spillage. So when there's a mercury spillage, never touch the mercury with bare hands as it can be absorbed through the skin. Remove all jewelry while dealing with mercury. Clean the area around the mercury spill with using PPE, and wear protective gear consisting of gloves and or 2 pairs of latex gloves. Draw the mercury into a syringe and pour it into a glass container containing water, and put the scotch tape around the bottle, and then uh, put it in again in the yellow cover and tie it and mark on it as mercury spillage. Next, please. So this is the protocol for mercury spillage management. As I mentioned, after that, disposal options include medical instrument manufacturers. So it has to be either returned to the instrument manufacturers, or it auction to mercury recycling. So these are the options for disposal for the mercury spillage. Next, please. So overall, we till now we saw about segregation, how it is done based on color coding system, and for our staff to do this segregation in the best way possible, a continuous training for the staff is required So regular training sessions on waste management protocols, update on new regulations and best practices, certification and reinforcement of adherence to waste segregation guidelines has to be done. So this is a picture that shows color-based coding and all bins. This is in the IPW, and also a chart showing how each of the biomedical waste has to be segregated into various bins. Next, please. So next comes the collection. So biomedical waste should be collected on a daily basis from each ward of the hospital at a fixed interval of time. There can be multiple corrections from ward during the day. Collection time should be fixed and appropriate to the quantity of waste produced in each area of the healthcare facility. General waste should not be collected at the same time or in the same trolley as the biomedical waste is collected. And this collection also applies to the inpatient ward as well as operation theater. So the first picture shows the bins just adjacent to the operating table. And the second picture shows from the OR, these bags are collected and the contents of the bag are placed into bigger bins that are in the corridor. And from there, it is collected, it is sealed, and the barcode is put, and all it which mentions the date and the what kind of biomedical waste it is. And this also is followed according to the color code. Next, please. So once collection is done, packaging. So biomedical waste bags and sharp containers should not be filled more than 3/4 full, after which they should be sealed ready for collection. Plastic bags should never be stapled, but may be tied or sealed with a plastic tie. Color-coded waste bags and containers should be printed with the biohazard symbol, labeled with details such as date, type of waste, waste quantity, sender's name and receiver details, as well as barcoded label to allow them to be tracked till the final disposal. Next, please. So coming to labeling of all the bags, containers, bins used for collection and storage of biomedical waste must be labeled with the symbol of biohazard or cytotoxic hazard, as the case may be, as per the type of waste in accordance to the BMW rules 2016. Biomedical waste bags and containers are required to be provided with barcode labels in according with the CPCB guidelines for barcode system for effective management of biomedical waste. So next is safe handling and disposal. So before handling, use of personal protective equipment is mandatory. So providing PPE for all employees that are while they are transferring the biomedical waste for disposal. Regular training on the correct use of PPE, monitoring and enforcing PPE compliance, and safe transport of waste using clearly marked secured containers for waste transport, in-house transportation of biomedical waste from site of waste generation to central waste collection center within the premises of the hospital must be done in closed trolleys fitted with wheels for easy maneuvering, conducting regular audits on transport practices, and and it is made sure that the waste disposal, uh, the trolley, it does not go through the high risk areas, neither does it go through areas where there are too many patients waiting. So it is taken through either a slope from the side of the hospital where there are not too many people crowding is present. So this is mainly because we for patient and staff safety. Next, please. So coming to central waste collection for biomedical waste. So segregation of the waste according to color code, complying with the local and national disposal regulations, partnering with certified waste disposal companies, we have a valid agreement with the authorized common biomedical waste treatment facility for treatment and disposal of biomedical waste. Daily disposal to this biomedical waste plant is done. So while they come for collection of the biomedical waste, we weigh the amount of each type of biomedical waste, and we maintain a documentation and enter into a register. And we also do yearly visits to this biomedical waste plant to inspect for proper disposal methods. And we also send annual report, that is Form 4, to the Pollution Control Board. So this is the way that each color coding is done for each kind of biomedical waste, as you can see in the picture. And each of these doors have to be within lock and key. And again, there has to be a chain which is under lock and key so that nobody can go beyond this point. Next, please. So next is immunization of staff. All the staff who are involved in handling of biomedical waste in the healthcare facility must be immunized against the communicable diseases, especially hepatitis B and tetanus. Evaluation of immunization status of the staff must be included in the annual health checkup. Hospital needs to maintain the immunization records of all the staff with dates of immunization and due date of first, second dose and the booster dose. Another important aspect is training of healthcare workers. So training of healthcare workers as per the Biomedical Waste Management Rules 2016 is mandatory for all the employees of the healthcare facility to be trained on handling of biomedical waste, management and handling. So training effectiveness of can be evaluated by observing the same parameters as listed through a test that is mock test or verbal or written test that can be conducted immediately after the training. Next, please. So coming to the regulatory compliance and legal liabilities. So the healthcare facility should ensure collection, transportation, treatment, and disposal of biomedical waste as per the BMW rules 2016. As per these rules, the liability for implementing BMW rules lies with the occupier or the person having administrative control over the healthcare facility. He or she shall be liable for any harm that may occur to the environment or people due to improper handling of the biomedical waste generated from the facility. In case of any violation, the occupier shall be liable for action under Section 15 of Environment Act 1986. To avoid any legal implications, the healthcare facility must meet all the responsibilities as listed as per the guidelines. Legal actions that can be taken against the healthcare facility for violation of the provisions or the directions under Section 5 of Environment Act are as follows. That is closure or prohibition or regulation of any operation or process, stoppage or regulation of the electricity or water supply, or closure of the healthcare facility. Legal actions for violations of the provisions under Section 15 of the Environment Act includes imprisonment up to 5 years or fine up to 1 lakh for each failure or contravention of the rules or code. In case of violation continues, additional fine which may extend to 5,000 rupees for every day of violation. If the contravention continues beyond a period of 1 year after the first date of contravention, the offender shall be punishable with imprisonment for term which can extend up to 7 years. Next, please. So at last, I would like to stress upon employee training and awareness. So mandatory training programs, implementing on-board training sessions for new hires, ensuring annual refresher courses for all employees, tracking training completion and effectiveness, also continual education, offering workshops and seminars on waste management, providing access to online courses and resources, and encouraging participation in conferences can help us maintain a general awareness among all our employees and help us work in a safe environment. Thank you.
Thank you, Dr. Deepthi. It was really interesting, and to know all these points it is very important in today's world. I would like to open the discussion to the panel. I would request Dr. Deshpande sir to please comment on this. So you're mute. So you're muted.
Yes, as she told about all the acts and clauses, they are correct. But whenever it happens, there is one tribunal, and that is called a green tribunal. That is National Green Tribunal, which has GNGT, where the all cases goes first there, and there they are tried, and the punishments and whatever is true and what not is not, it is seen. Generally they are not referred to the regular courts, but they are referred to the tribunals, and this tribunal was established in 2010. So all these cases, first, whenever you are starting a clinical establishment, you have to register under that, and so that the registration number is there, and there can be your own method of disposing, or there can be a central method. If the corporation is there, corporation agencies are there, which collects the waste and disposes of that their own risk. So both the things are there in existence, and that depends upon the how big the town is, where the facilities are taken over by the corporation or the municipality, and that depends upon the capacity of that corporation.
Sir, would you like to comment?
I think it was the fantastic lecture given by Dr. Deepthi. Very well covered. All aspects were very well elaborated. One important thing what she told in this at the start only, that this biomedical waste disposal is related to infection control. That is also very important aspect, because it is the medical premises, OT and other things where infection control is also the important aspect. Other thing I like to tell here that health is the state subject. So biomedical waste is important national point of view, but each state has got separate law and separate rules. So every state treats it in its own way. That is the thing I like to tell. But nowadays, these laws are very strict for biomedical waste disposal. And Dr. Deshpande must be knowing about registration under that Maharashtra Pollution Control Board. In that, they had asked doctors and hospitals to give their investment and their instruments, and then amount of investment in the hospital and chartered accountant certificate, everything was asked for. And IMA and various organizations are fighting for it, that it is not correct. And for the clinics also, it is very difficult. So those strict rules and regulations they are fighting for. That is the thing I like to tell you.
Yeah, it is as to support Dr. Marathe was here about a year's told. Though the laws are different in different states, the state pollution boards are always there in every state, and only any establishment, including a small clinic where there is a chance of having the waste, the biomedical waste, they should be registered. But at places where only examination is being done and no waste is there, then that clinics can be omitted from registering under this board.
That's what we have been telling. But what they say that you may get those samples and there is expiry date for that sample. Then where are you disposing these things? So they are forcing even for clinics where only the consultation has been taken place, like physicians and straightforward.
Physician, where you
no
are not disposing
no
anything.
injection is given, no dressing is done. So still they are insisting and troubling a lot.
That
even
is
in
always good to
ophthalmology
register.
clinics,
Yes.
even in ophthalmology clinics, suppose we are just doing the consultations and no procedure is being done, probably no biomedical waste is generated, but according to law, you must register your clinic. So clinic registration for biomedical waste is must. That's what everyone should remember. Even if you are not generating the biomedical waste, that's what I'm saying.
Arthur sir, would you like to
Yeah, that's what
highlight
I
some?
kind of late midway through the lecture, but it was a very well scripted talk by Dr. Deepthi. I compliment her for that. My views about medical legal is that now Dr. Prakash Marathe enumerated, like even simple ophthalmology clinics, especially in my state, Telangana, like these corporation inspectors visit and they just try to fleece out, saying that even though the biomedical waste is not generated in those small clinics, they are treated on par with eye care centers, and then they want that kind of a registration and payment to be precise, so that this biomedical waste management is actually is leased out to some agencies, and those agencies, they don't exempt even small clinics, and they want them to pay on par with eye centers. So that issue needs to be taken up if possible through relevant channels, and then things should be, even in our state, the registration of clinic is required, and appropriately we need to manage the biomedical waste.
Dr. Diddhi, I think you have a question. Do you want to ask something? No. No. Aarti ma'am, Kaushik sir, any questions for the panel in today's discussion?
Sir,
Nothing.
what are the requisites for NABH regarding biomedical waste management?
It is the basic requirement. It is must for each and every NABH accreditation. That is from the scratch you have to start. There is no second thought for that. It is must.
Aarti
So
ma'am, would
few
you want to?
mandates that I would want to mention, according to NABH accreditation, is they do stress on closed bins everywhere that we use. They do stress on closed bins, including within the OPD, in the corridors, in the OT and IPW. So it is not possible to use closed bins at all place. So in case we are using open bins, we have to make sure that they are disposed timely and much quickly. And they should not be a long duration that they are within the OPD and the corridors.
Basically,
And we
the
have
thing
to
come to infection control. So that is the reason, like the NABH procedures, they insist on closed bins. And as you're saying, open bins, they need to be disposed of periodically to avoid infection risk to the people in the OPD also.
yes, sir.
Also, sir, along with this, I think it is important to have an infection control committee also of the hospital. Can probably regulate this and monitor the movement of this waste management, because sometimes it is overlooked and it is not done properly.
Yes, I agree. So this infection control committee, we do periodic audits to make sure that these are implemented both in all high-risk areas. So that includes hand hygiene, whether hand rub is being followed, whether proper disposal is being followed, whether the opening date is being mentioned on the medications that are being opened, and whether they are being discarded within 1 week. For example, Ziplocs or Paracaine eye drops. So opening date has to be mentioned on all these bottles and whether they're properly being disposed in the appropriate bins. So we do a periodic audit, and every month we go through this, and wherever we see that there is a deviation from the protocol, we sensitize the staff then and there so as to reduce the incidence of the same.
May I have the question
Please, sir.
Yes, sir.
for each and everyone? Suppose there is a needle prick to the doctor, operating surgeon, or the nurse, or the staff in the OT or in hospital premises, and the patient is normal. That is first case. Second is patient may be hepatitis or HIV positive. And third thing, you do not know about the patient. These are the three scenario, and needle prick is there.
The scenario is three. You are correct. But before taking for the surgery, one has to examine for HIV and hepatitis B. And if they are there, special precautions and special OT should be taken care so that the infection will not spread and doctors and other people will take proper care. So there is a binding of before doing any surgery to do HIV and hepatitis B.
So my
What about
question is different.
sir?
Suppose there is a prick in the ward or consulting where the HIV and hepatitis B checkup is not done, and there is the accidental prick. And my other question is uh, that accidental prick is in operation theater, knowing that patient is HIV positive or hepatitis B positive, and that prick has happened. What are the things to be done for the treatment of that hospital staff or doctor or nurse?
So, may I take this question, sir? So,
Yes,
when
ma'am.
there is a
Yes.
prick to the staff from the patient who is a known positive patient, so the first thing is we must wash our hands, the site of prick under running water or soap water, and never should we squeeze and see whether and try to express blood from the site of the prick. And then immediately we have to inform to the HIC convener, the quality manager, and if it is beyond the hospital working hours that it happens, then we have to inform in the IPW. And immediately, according to the protocol, if it is a prick with a positive patient, the post-exposure prophylaxis has to be started within 24 hours, and that includes 3 drugs that is to be used for 1 month. And sample before taking prophylaxis samples, even though the patient is a known positive, samples from the patient and the person who had a prick have to be taken, and they have to be sent for the as a routine both for hepatitis B and HIV, as well as we must take the records from the patient to know what was the patient's CD counts. And based on that, probably the physician will advise only if zidovudin and lamivudin is enough, or an additional drug has to be added within the protocol. Apart from this, suppose the doctors or the staff report has come negative when immediately taken after the prick. Again, the blood sample have to be taken at 6 weeks, 3 months, and 6 months, both of the patient as well as of the staff.
It was very well answered, madam. Fantastic answer. Really, the scientific way you have elaborated everything.
Thank you, doctor.
Aarti ma'am, any comments from your side? She's gone, I think. Mathur sir, anything from your end?
No, this kind of a situation happened in our hospital with the surgeon who was operating. She had a prick. So at that time, we were not aware of this protocol, but patient's HB, has serum hepatitis and HIV were negative. So what we did is we took the patient sample and also sent for hepatitis C just to be on the safe side. Luckily, that came negative, and then she did wash the hands. One question for Dr. Deepthi, like why are we not supposed to squeeze and wash?
Wash we have to do, sir. We have to wash under running water or soap water.
What if we just squeeze and put the finger on the running water?
Doctor,
Do,
only.
does it just squeezing without washing? I can understand. Like once you release the thing, exposed blood may get back into the circulation, but putting pressure on the finger under running water should not be an issue.
Okay, sir.
Yeah.
I have a
And
question
sir,
for this. I have a question in this. For all the patients, be it CAM setting or be it like a paid patient setting, like, is it a mandatory thing to do HIV, HBsAg or HCV testing, like viral markers, or is it done only in probably the paid setting? And what should be the protocol?
It should be similar for each and everything, not because it is paid or unpaid. It shouldn't make any difference. I think
Even in our
fitness point of
private
view,
subsidized surgeries, we do ask the patients to get these basic tests done. Without that, we don't take them.
So are there any guidelines like written documents on which
What should be
formulate the
followed?
actual guidelines? Like for cataract surgery, these are the minimum investigations which needs to be done.
We are preparing it at present. We are preparing
Okay, sir.
all the guidelines together and bringing it up very shortly. And SOPs
Yes.
with the help of Dr. Bathur and Gajiwala.
Yes, sir.
They will be on our website soon.
Yeah.
I think the topic has been covered really well. Most of the queries or discussion has been already been put up in the presentation. So if there are no more comments or questions, probably we can close the session.
yes.
Kaushik sir, Marathi sir,
Yes,
anything?
yes.
So on behalf of YOSI and YOSI Medical Legal team, I would like to thank all our panelists, Deshpande sir, Marathi sir, Mathur sir, for taking out time for this another exciting session on YOSI Medical Legal, Biomedical Waste Management, and it was a very well delivered talk by Dr. Deepthi Molleti ma'am. Thank you, ma'am, for joining in and enlightening us with this important the topic of in today's era. It is very important in order to have better biomedical waste management. Also, I would like to thank my co-moderator, Dr. Riddhi, and my team members, Dr. Kaushik and Dr. Aati ma'am. So, I would like to say good night to everyone, and probably we'll join in next month for another session. Thank you. Thank you for all. Thank
Thank
you
you.
to all.
Thank you.
Good
Good
day.
night.
Thank
Thank you,
you.
sir.
Thank
Thank
you.
you.
Good night.